Hello and welcome to this week's India Today special Corona Dialogue, where we bring together some of the world's global public health experts to discuss issues concerning Corona, COVID, and its impact across the world. Today we are joined by one such special guest, one of the world's leading public health experts and researchers from the University of Edinburgh, joined by Dr. Devi Sridhar. Appreciate your joining us, Dr. Sridhar. We want to get a sense of the global picture across the world at the moment with COVID. Given what you're seeing in the United Kingdom at the moment, where in the last week actually cases are coming down, even though the country has opened up, we've got some leading epidemiologists who are claiming that the virus will be over by the autumn, that the worst is over. Can we really finally say that a country opens up, cases are lowering as in the United Kingdom, and the worst is therefore over possibly for the coronavirus?
Well, I think the UK is in a very special situation because our vaccine uptake is so high. In groups over 50, it's over 90%. And even now, vaccinating into people over than 18, the take-up is incredibly high. So I think in places that have that kind of vaccine uptake, I think, yes, the worst is behind us. But in places where vaccine uptake isn't that high, think of most of the world, there's over 70 countries with less than 5% of people vaccinated. Unfortunately, I think Delta is going to cause a lot of problems, and the pandemic globally will not be finished in just the next few months.
So let me get this clear. The lesson, what you're saying from UK is that UK in a way is sui generis, that what we've seen in the last month is that you can open up, but you can only open up when you've vaccinated a really substantial section of your population, as the United Kingdom has. Is there an ideal number that you would say that open up, let's say that when you've vaccinated 50, 60, 70 or 80%, as we've seen in the United Kingdom, over 80% of its adult population now vaccinated?
Yeah, but I have to say things aren't exactly normal, I would say, in the UK. I think a lot of people, I mean, remember, we've been in this for 18 months. Britain has one of the highest death tolls per capita. We've been under very prolonged restrictions. So people's behavior has also changed. So even though legally restrictions have lifted, if you do look around, people are distancing more. They are working from home. They're wearing face coverings indoors. They're being cautious because they have learned the toll this virus can take. So in some way, the lesson is yes, vaccines. Yes, testing, but also people just being cautious in a way they weren't being at the start of the pandemic. So
what you're saying is that, you're not ruling out in a way the possibility of another wave. Are you saying that those who suggest that the virus should be behind us by the autumn are being overly optimistic, irrationally exuberant, if I may say so?
I mean, it's impossible to say what the future will hold with this virus. I mean, at every twist and turn, there's something new. I mean, who could have anticipated we'd all be talking about Delta now and Alpha just a few months ago? I think that what we can say is that in rich countries that have managed to vaccinate a substantial proportion of their populations, upwards of 60 to 70% of their adult population, they're on their way alongside testing to be able to have the worst behind them. The winter will still be bumpy. We still have a lot of children unvaccinated. Kids under the age of 18 have not been offered a vaccine. There are still a lot of people who can still get this virus. The question is, how bad will that be in terms of health outcomes, and can we manage that in the winter months?
It's interesting that there for a moment you mentioned children, and I just want to focus on that because, that's becoming slowly a big issue in India as well. Do we open up schools for those below the age of 12? At what stage do you do so? How safe are our children, even if their parents are not vaccinated, if they're not vaccinated? Would you advise that schools be reopened in a country like India, given our vaccination levels at the moment?
I think schools should definitely be open. We know the harms of keeping schools closed is massive, and UNICEF has called this a global educational emergency, and many of these children may never go back to school or have educational loss for their lifetimes. The question is not whether to have schools open or close, it's when they're open, how do you actually try to maintain safe environments, meaning ensuring there's regular testing, that all teachers are vaccinated, that when needed there's masks being worn, that outside learning, ventilation. These are the lessons we've learned, that actually we can keep schools open, but the way to keep them open is just having in place these kind of mitigation measures that make it safer for children and for the teachers.
That's an interesting way of putting it. Do you therefore believe that the critical vaccination age group remains the same? vaccinate first, of course, those above the age of 45, then over 18. Do you believe that children in particular below 18, below 12 are relatively safer and therefore they should be going out there to school at the moment? Am I correct?
Well, there's two different questions. Should children be going to school? Yes. Are they relatively safer than older people? Yes. Are they completely safe, meaning they will not get ill? No. We know children can transmit the virus. We know they can get quite ill from this as well, much less so than older groups. Therefore, of course, like the United States has done, if there's enough supply, it would be great if we can vaccinate across the world kids over than 12. We have a safe and approved vaccine too, Moderna and Pfizer. But if there's limited supply, you have to prioritize. And obviously, I think prioritizing teachers, the adults, the janitors, the cleaning staff, teaching aides, parents, grandparents, these are the people to prioritize. And then when you get to the stage, then moving into vaccinating children.
You know, let me come also to another part of the world that at the moment is again in the COVID crosshairs in a way, the United States, you know, which opened up but is suddenly witnessing a rapid increase in cases linked to the Delta variant. Is that because the US has not vaccinated as much proportion of its population as needed, or just the fact that Delta is extremely contagious?
Yeah, I mean, I think there's two things. That whenever you think the worst is behind you, something new happens. So Florida, my home state, many people pointed to and said, look, it's doing so well. Now Florida is seeing the steepest rise of cases and hospitalizations in the United States because of vaccine hesitancy. These are people who either because of something they've read on Facebook or because they're worried about what they have heard from their friends, don't want to be vaccinated. But that leaves them vulnerable to getting extremely ill. And when they are in hospital, they are then asking, can I please have the vaccine now? And at that point, a vaccine is not a treatment. It's not going to help you at that point once you're in hospital. The time to get the vaccine is, several weeks before you're actually exposed, ideally 5 to 6 weeks to have a full, robust immune response. It's a bit like having a bulletproof vest on. It's not going to stop you getting shot, but it will help you survive and hopefully come away not having serious illness. And unfortunately, in the United States, because of a large amount of, I think, misinformation and hesitancy, people are not having the uptake that luckily that we've seen in Britain, where there is still a lot of trust in the vaccine and young people as well wanting to have it to see this as the way to continue their lives.
Dr. Sridhar, what about India itself? Because India at the moment about 10% fully vaccinated. Do you believe that we still therefore are a long way from believing that the worst is over, that India in particular can be susceptible while the Delta variant is still around to a potential new wave?
Yes, unfortunately, I think, there's always a danger in saying the worst is behind you. We know that with India already, there was, claims made that the virus was gone. We saw it come back with a vengeance with Delta, even talks of Delta Plus. And now looking at the vaccination rates and knowing that actually people can get COVID twice, just thinking that through the natural immunity of a lot of people having it, you'll be through the worst, we realize is not true. So I would be telling people to be cautious, to go and hopefully, get it vaccinated and to continue building up hospital capacity, oxygen, beds, medical care, to make sure that actually when people become ill, they have somewhere to go and be treated.
The other concern in India and across the world is reinfection even after being vaccinated. There are people in the United Kingdom who are double vaccinated and we are told still getting hospitalized, not necessarily all of them severely, but still going to hospital. Is that a concern that there are limitations to vaccines preventing reinfection?
Yeah, so there's different layers of protection. What is your chances of be testing positive after being doubly vaccinated? Yes, we are seeing that clearly. The question then, is that translating into severe illness? In some rare instances, it is. But I would say, we have to see the vaccine as layers of protection. That is one layer. Of course, if you have someone who's extremely elderly or frail or vulnerable, they are at higher risk, even being doubly vaccinated, of getting more sick. But they are just still doing better than they would if they hadn't been vaccinated at all. It's still an additional way of prepping your immune system to fight this virus when it sees it.
I recall talking to you, Dr. Devi Sridhar, towards the end of last year, and then you had warned that 2021 could be the year of variants. And that's exactly what we've seen. Alpha, the Delta variant at the moment, spreading across the world. Do you fear that there are more variants out there that could spread across the world in the next few months, including in India?
Well, there's definitely going to be more variants because this virus continues to spread. And when it spreads and replicates, there's additional chances for mutation. And all it takes is for a certain mutation to give it an additional advantage, for example, to be more transmissible or to infect people who are doubly vaccinated, or to, affect children, a group that usually hasn't been affected that heavily, and it will spread more rapidly. That it's selection pressure that we're seeing now on the virus and various variants. The question is, will we see one that is more transmissible than Delta and outcompete it? Mm-hmm. Hopefully not, or hopefully at least not within the next few months while vaccines are rolled out. But to vaccinate the world, people across India, but also across South Asia, African countries, Latin America, we are looking at going into 2022, even possibly into 2023. So there is now, a huge pressure to get those vaccines out fast enough before we see the emergence of what we might say the next one that might be even worse than Delta in terms of spreading.
You make a point that a good point that the world should be worried about, because what is it? Close to 35% of the population in advanced economies, Dr. Sridhar, fully vaccinated, compared with less than half that number in emerging markets, only a tiny fraction of that in low-income countries. We seem to be getting into a world that's going to be divided between the vaccine haves and the vaccine have-nots.
Yeah, and sadly, you could see this happening in advance because this is what has always happened when products are scarce. Think of Ebola, think of previous crises, swine flu. It has always been that rich countries, despite making pledges to share, keep the doses for themselves and their citizens, and they are happy to share later on when they're not facing acute pressure. And the lesson for me is not to have more pandemic treaties, not to have more agreements, but to think about how do you make different regions of the world self-sufficient and not dependent on Western charity. That means how do we build up factories, get tech transfer, get human resource capacity built in, have emergency IP legislation so that actually in emergencies you can ensure that places across the world can manufacture vaccines. These are the kind of steps we have to be taking, because just asking rich countries to share, we see just doesn't work. And it's not just true of COVID, it's true of 2009 with swine flu, 2014 with Ebola, and go previously. This is a pattern we have seen over and over, so why would we expect it to change?
Dr. Sridhar, I don't know if you've had a chance to look at what is described in India as the Kerala model, but the situation in Kerala at the moment, one state now accounts for more than half the active caseload in India. Now, this is a state where, the number of deaths have been low. There's a strong public health system. The Sero survey says far fewer people have antibodies compared to other parts of India. In a way, do you believe that states like Kerala, with a strong public health system, are also going to struggle at the end of the day with COVID? That there is therefore no foolproof system? How do you see this Kerala paradox in a way? Strong public health system, but now rising COVID cases.
Well, I mean, the first thing to say is Kerala did incredibly well at the start of the pandemic in using mass testing, supported isolation, to use that public health infrastructure to make sure the virus did not spread and to keep those deaths down. Unfortunately, now with Delta, it is so transmissible. The viral load is 1,000 times higher than the original wild type. It is very hard to stop it transmitting using the tools that we used in 2020. And so probably also in Kerala, you have more testing per capita, which means you find more cases. If you aren't able to test as much, you'll find fewer cases. And plus, they're in some way a victim of their success because there's less antibodies built up in the population. There's more chances for the virus to spread. They've managed to keep deaths down, but now the challenge is to vaccinate faster than the virus can spread.
Let me turn to something else interesting again. Let's look at the world. Schools have closed, of course, for the summer in the United Kingdom. The Euros are over. People are out now celebrating whatever remains of the summer. But by and large, if I were to ask you 3 months from now, do you believe that with so many people going outdoors, celebrating at the moment in the pubs, in the restaurants, we will be in a better place than we are today in large parts of the world, or will it vary from country to country?
I don't think it'll be a happier place. It might be one where we have a better source of direction. Right now, we have tools that we did not have a year ago. We have vaccines, we have testing, we have better treatments. The challenge is not the scientific, technical side of of finding these. It's now delivering them. So in a way, we are in a challenging situation of getting these out, but we know what we have to do. Now we just have to do it. And even in Britain, I mean, I don't think anyone is thinking the winter will be easy. We already know with flu and other respiratory viruses that the winter is anyways a difficult period. It's very cold, days are short, people go indoors, and the NHS, the healthcare system here is extremely stretched. So I think right now the question is, can we make this a better winter than last winter? Hopefully so. Will it be an easy winter? I don't think anyone is going to look ahead and say the next 6 months is going to be easy for Britain or anywhere else in the world.
So I guess, there's cautious optimism at the moment, because I guess that's the only way one can deal with coronavirus, given what's happened. You're effectively telling me, in a way, that you're calling for people to not be irrationally exuberant, and presumably you're saying people can go out, but when you go out, please continue to observe COVID protocols. You can start lifting lockdowns also, presumably, Dr. Sridhar, when the test positive ratio is below a certain number, but don't resort to irrational exuberance when you go out and overcrowding. Am I correct that, we are still not fully over the worst?
Exactly. There are things that everyone can do, hopefully in their daily lives, to reduce their chances of getting COVID. Open the windows if you're having visitors at home. Sit on balconies. Go out for walks in gardens and parks. Try to keep your distance from others. Wear face coverings when you're in crowded places or you're indoors. We know how the virus transmits. So I think having people know that and then be able to make choices how to live their life within that is one of the important tools we have as well, all of our behavior.
But what about this whole issue, and this is across the world a concern, this whole battle that continues between lives and livelihoods? When do you lift the lockdown? I ask you this because you were among those who seemingly was skeptical about the United Kingdom lifting the lockdown at this moment. Would you say that countries like India can take the UK example, lift the lockdown? Is there a perfect time really that is there to lift the lockdown that exists still in several parts of the world and India?
So I didn't say that I was against lifting restrictions. I was against lifting all restrictions. And I think England has gone still too far. They had a Freedom Day where they said, basically, let's lift everything and, celebrate the end of the pandemic. And as I've kind of mentioned, I don't think that's the right way to approach it. We're going to have to manage this carefully. So yes, I'm happy things are open. We are going to have schools open soon. Most of restaurants, hospitality, businesses are open now. But there's a note of caution in there that we don't want to go backwards. And so we can't say to people, this is Freedom Day, it's over. We have to say, we need to monitor the situation because we know it's unstable and uncertain. And every month we are learning more and more of how to stay open and keep people healthy at the same time.
The reason I'm asking you this is because there are a lot of people who are really hurting, livelihoods that have been lost. So it's not just about lives, it's also about livelihoods. And the longer the lockdown persists in some parts of India and the world, the more anxious people get, worried about, how do they restore their livelihood. So how are we going to achieve this balance? That's really where I'm coming from.
Of course, and I think that has been the concern from the start. But if you go back to the start and look at countries, for example, in Scandinavia, Sweden stayed open out of a concern of livelihoods. Its Scandinavian neighbors, Norway and Finland, went into early lockdowns. In the end, their economic performance looks about the same because people vote with their feet and their behavior in terms of consumption. So the economy took the same hit across the three, but Sweden's death toll is extremely higher. And in the end, had to impose restrictions because hospitals filled up. So I think the lesson here is that if you do try to choose livelihoods alone, the virus will get you, and you can't save the economy by sacrificing lives. It's a delicate balance of actually trying to do both, keeping the virus at a very low enough level that you can have economic activity and people staying in jobs and earning money.
Dr. Sridhar, from your experience over the last 18, 20 months, have you seen any country that has cracked the COVID code? Is there a country that we can hold up and say, well, look at this country, that's the way to contain COVID?
Well, it's really tricky, right? Because every country has its circumstances. So yes, if every country had a small population, it was in the middle of the Pacific, then the way to go is the island model, like New Zealand. Seal off to the world, have a full domestic recovery, and then vaccinate your whole population as New Zealand is doing, and then you open up to the world and you don't take deaths and you've kept your economy going. But of course, they have a small population. This has been much more difficult in places with large populations. They have an island status, much more difficult if you have borders with other countries and constant movement across it. And also you have to be wealthy enough to be able to support people during a lockdown. So I think there isn't one size fit all. There's different models. We've seen the South Korea model of just mass testing and tracing. You've seen, the German model of actually having lighter restrictions, but hoping that, again, people will isolate when they're asked to. You've seen the Swedish model of saying, let's try to live with this and, ask people to continue with their lives and keep the economy going. I don't think there's one perfect model because they all depends on what you're able to do based on your geography, your population size, and your wealth.
I sometimes really wish I could live in New Zealand, but from your vantage position then, Edinburgh, any advice that you would give to India at a time, as I said, where we are a bit of at the crossroads? Vaccinations haven't taken off as fast as they should have. We are vaccinated some days 60 lakhs a day, others it slips to 40 lakhs. Several parts of the country have opened up, one or two areas of concern, Northeast, Kerala. But any advice broadly, any concerns going ahead from an Indian perspective?
I mean, who am I to give advice? I mean, you have brilliant advisors and people who would know the situation better. I mean, I would just say be cautious around this virus. You never know what's around the corner. The real tools we have are vaccination, mass testing, and telling people how to avoid getting it so they can take those precautions themselves and try to provide economic support to those places which are struggling, those sectors who need help. Figure out a way to get those packages, financial packages out. And I guess a final note on schools, that we need to find a way to get schools open. We've learned that children are not super spreaders of this. They're relatively safer than other groups, though of course not immune. And so there should be a way to get in-person schools back so we can get kids back on track and learning.
The school problem, I might add, is also coming at one level, Dr. Sridhar, from parents' anxiety. Parents are the ones who are anxious, as are policymakers. Parents want to send their children to school but are worried that if, God forbid, something goes wrong, what happens? So are policymakers. That perhaps explains the caution when it comes to opening schools in some parts of India as well.
Yeah, I can understand that completely, of course, with children. But I think the reassuring message has to be that if parents are vaccinated and those in their household, that is a layer of protection. That if in the school they're trying to keep ventilated, keeping windows open, getting outside for lessons, wearing masks, these are all important precautions that can keep their children safe. So in a sense, the choice isn't send your kid or not send your child. It's actually what are the things that we can do now to make sure when we send our child that we're making it as safe as possible. Nothing is 100% safe. We're trying to make it as safe as we can so that actually less people get the virus and transmit it.
Dr. Sridhar, you said earlier on the show, one size doesn't fit all. There's no one success formula to combat COVID. I just want to give you the example of Mumbai, a huge city in itself, larger than New Zealand in its population. Many Mumbaikars have been asking me in recent days, why are our trains not opening up now that our numbers are coming down? People getting anxious. Would you advise that cities like Mumbai, large, densely populated cities, open up to public transport at a time like this?
It's a really difficult one. I don't know the exact, concerns over case numbers and hospital capacity, but I think the real thing to say is that if people are on public transport, need to be wearing face covering so you're not coughing or sneezing or infecting others. We need to try to keep these spaces open because people need to get their livelihoods, but in a way that's safer. And face masks are a way to do this because we know they can block the droplets and the way that the virus spreads between people. But it's a very tricky balance because if your hospitals are full, you will have young people dying because they cannot get basic care. And at that point, that is when you are forced into shutting down things like transport because you're trying to stop the spread of this virus and stop people getting infected and getting ill faster than your hospitals can actually cope with that.
So what you're saying net is even if cities open up like Mumbai in terms of public transport, do it cautiously, do it with a lot of citizen participation in terms of COVID protocols, masking, etc. That it's not going to be about lifting a lockdown almost overnight and changing the world back to where it was pre-COVID.
No, I think those are things that we can keep for a while. And I think they are important until people are. I mean, even in the United States, the CDC originally said that if you are doubly vaccinated, you do not need to wear face masks. And they have now reversed that because of Delta, saying even if you're fully vaccinated, you must be masked indoors. And so I think we need to be watching that carefully. And I know face masks, sometimes can provoke people saying it's uncomfortable. It is uncomfortable, but getting very seriously ill with COVID is more uncomfortable, I would say.
You know, I think you put a lot of issues in perspective, Dr. Sridhar, so it's always a pleasure talking to you. Thanks very much for sharing all your wisdom on public health protocols. Stay well, stay safe. I presume that you're also out and about enjoying the English summer.
Yes, actually the Scottish summer.
Scottish
I'm based
summer.
in Edinburgh,
Scottish
so,
summer, that's right.
Yes, out and about enjoying it.
That's right, you're in Edinburgh, the Scottish summer. You need to sort of hold on to the flag in a way of Scottish nationalism. I must make that distinction, my apologies. But thank you very much. Enjoy the Scottish summer there. And thank you very much for joining us here on our COVID dialogue.
Great, thank you very much for having me. Wishing you a good evening.
That was Dr. Devi Sridhar from the University of Edinburgh, one of the world's leading global public health professionals. And that's what we have for you on this week's Corona Dialogue. Thanks for watching. Bye for now.